Hello, I'm Bev Garside, the CEO of the Australian Thyroid Foundation, and I'd like to welcome you to this episode of Recover Me, talking about thyroid disorders. It will include patient stories, medical advisors' information, and general information that you need to be aware of about thyroid disease. As over 1 million Australians are living with some form of thyroid disease which is undiagnosed, this information is important for everybody to hear.
The following thyroid-related information has been provided by the Australian Thyroid Foundation. This information should not be used for treatment. Consult your medical professional if you have further questions and seek medical treatment. The thyroid gland is a soft, small, bow-shaped gland located in the front of the neck, below the voice box or larynx, commonly known as the Adam's apple, on either side of the trachea or windpipe. The healthy thyroid gland uses ingested iodine from iodine-enriched foods to produce thyroid hormone, which regulates body and brain growth and development, body temperature, energy levels, and metabolic functions, the rate at which the body produces and uses energy from nutrients and oxygen. Thyroid hormones influence and regulate the activity of all cells and tissues in the body. What happens when things go wrong? If the thyroid gland produces insufficient thyroid hormone, this is known as hypothyroidism, or an underactive thyroid, which causes the body's metabolic functions to slow down, resulting in many different adverse effects on bodily functions. If the thyroid gland produces too much thyroid hormone, this is known as hyperthyroidism, or an overactive thyroid, which causes the body's metabolic functions to speed up, causing adverse effects opposite to hypothyroidism. Thyroid cancer also appears to be on the increase, with 2014 thyroid cancer research showing the previous 10 years of thyroid cancer affecting an increase of 84% in women and 48% in men. The many causes of thyroid disorders include iodine deficiency, autoimmune disease, viral and bacterial inflammation causing thyroiditis, familial disorders, nodules which have formed on the thyroid gland, benign and malignant cancer tumours on the thyroid gland.
My name is Antoinette Latouf and I'm a senior journalist at Network 10. I guess my thyroid journey is a bit of an interesting one because while it's my job to tell the news, one day a big lump on my throat became the news when a viewer contacted Network 10 concerned about what she saw and wanting my colleagues to pass on a message to please go and check my thyroid. So you may be able to see that I have a scar on my neck. I did have surgery a few months ago. It was incredibly painful, but it went very well. They also found that I have Hashimoto's, the autoimmune disease, and that's something that I will manage for the rest of my life. I guess my advice is if you see something, say something. It was the kindness of a stranger who went out of their way to reach out to me that really had an enormous impact on my life and my health. And conversely, if someone does say something to you, take it seriously. I was at the doctor's office within a couple of hours, and the next few months really changed the course of my health journey, and I'm eternally grateful, not only for having someone reach out to me, but also for taking it seriously and going straight to the doctor.
Hi, I'm Amber. I'm 41. I live with my husband and our 2 young boys and also 2 very lazy dogs. I'm an active person. I love being outside, especially going to the beach. I was diagnosed with thyroid cancer in 2008. I had lymph nodes that were increasing gradually in size over the last few years, and it was a concern. My GP referred me to get a fine needlepoint biopsy and a chest CT scan. What they found was a variant of thyroid cancer known as papillary and follicular. It's quite a common form of thyroid cancer. However, mine was quite extensive with spread to my lungs and lymph nodes in my chest and my neck. It was quite a shock as I didn't really understand what a thyroid was. I'm currently in the management phase of my treatment. Initially, I had surgery to remove my thyroid and I started on thyroid replacement hormone. I saw an endocrinologist and a radiologist, and I started courses of radiation every 6 months for the next 3 years. The radiation for thyroid disease is very targeted, and whilst it was a challenging time, I responded well. I now have yearly scans to monitor for any reoccurrence. I also do regular blood tests to make sure that thyroid levels are optimal for me and I don't experience any underactive or overactive thyroid symptoms. Throughout my thyroid journey, I've learned that it's important to ask many questions and to feel comfortable with your choice of medical practitioners. Protocols for treatment are rapidly changing, and it's so important to just ask as many questions as you can to make an informed choice for your treatment. The thyroid, whilst small, plays a vital role in not only your physical well-being, but also your mental well-being. If not treated correctly, it can lead to poor mental health outcomes.
I'm Brianna Wilkes. I used to work front of camera in TV and in radio, and through that I became one of the ambassadors for the Australian Thyroid Foundation. And I've been doing that for a very long time, like maybe about 15 years, I think. I now work behind the scenes, but still in the industry. So about 13, 14 years ago, I actually was diagnosed with papillary thyroid cancer. Pretty crazy story as to how that happened, actually. The TV show that I used to host, which was to do with Big Brother, I used to sit on a panel on the left-hand side and talk to the guys sitting on my right. And a doctor watching me on TV saw that when I turned my head, I had this 1.5-inch tumor that kind of stuck out of my throat, and I had no idea it was there. So he, bless him, spent a whole year trying to get in contact with me to tell me to go to a doctor and get it checked. And then, look, long story, but condensed, the girl, one of the girls that I was on Big Brother with, happened to go into his surgery, and he recognised her and asked if she still speaks to me, which she did. And he said, tell her to go and get her thyroid checked. Now, I didn't even know where my thyroid was. I thought it was up around my ears somewhere. So I thought maybe he was a little bit bonkers. But next time I was at my GP, I mentioned it to him, and he was like, yeah, I can see it sticking out of your throat. And so 3 biopsies later and some ultrasounds, it turned out to be thyroid cancer. So I was very lucky to have one very observant viewer. After my diagnosis of thyroid cancer, I actually had 2 surgeries and radioactive iodine treatment. That was probably 13, 14 years ago now. I'm really lucky. I've had no ongoing effects of the cancer, the treatment, the medication I'm now on every day. So I'm really fortunate. I don't struggle with that at all. And so now I just have 6 monthly checks, I've been having babies and things like that the last few years. So I keep a closer eye on, thyroid levels and things like that during pregnancy. I guess something that I didn't know is how common thyroid conditions are. And I know they're on the rise, but I think it's a very little known about organ that does a lot, and I guess a lot can go wrong with it as well. So I feel like, a lot of people talk to me about thyroid conditions because they know that I've had one, but I feel like it's so much more common than what we think it is. And, you're constantly getting these messages to check your breasts and check your skin, which are amazing messages. but no one says check your neck. And that's a really important message to get across. I think people need to know what they should be looking for and need to know where the thyroid is, unlike me, and just be more observant in general. Because, if someone hadn't told me, I wouldn't have known that I had it.
How common are thyroid disorders? Thyroid disorders affect all Australians of all age groups and demographics. Awareness is the key to ensuring that you do not overlook a thyroid disorder which could be affecting your health and well-being. 1 in 10 Australians will be affected by some form of thyroid disorder. 7 of the 10 will be women. Over 1 million Australians are undiagnosed. 60,000 Australians are diagnosed each year. Thyroid cancer is increasing, affecting younger Australians. Iodine deficiency and thyroid disorders affecting pregnancy outcomes for women of childbearing years. Thyroid disorders affect 10 times more women than men worldwide. Thyroid disorders, especially hypothyroidism or an underactive thyroid gland, become more common as we grow older. Iodine deficiency has re-emerged in Australia, and we can expect more people to suffer from swelling and enlargement of the thyroid gland, also known as a goiter. Thyroid disorders can be difficult to diagnose due to many symptoms being similar to those of other medical conditions. The Australian Thyroid Foundation recommends diagnosis using biochemical testing, serum TSH, T4, T3 and thyroid antibodies. A thyroid ultrasound is essential to determine the structure of the gland and define any physical abnormalities within the gland. If further testing is required, your treating doctor may order additional screening with radionuclide scans or CT to determine an accurate diagnosis. Treatment for thyroid disorders may vary on results and in consultation with your healthcare professional. Common treatments administered by your GP can be for hypothyroidism or an overactive thyroid, hypothyroidism, underactive thyroid. For more severe cases where thyroid cancer has been detected, hospital treatments can include surgery when a patient has a suspicious nodule or nodules which could be malignant or an uncontrollable overactive thyroid gland. Surgery can be followed up with radioactive iodine treatment or other drugs. Speak to your doctor about your symptoms, your family history, if any member of your family has had an autoimmune disease, thyroid disease or cancer.
Hi, I'm Jess Hall, MasterChef 2019 contestant. My diagnosis was a hyperactive thyroid, Graves' disease and multinodular goiter. This was discovered after I was experiencing really chronic fatigue, and at the age of 25 that was quite concerning. This combined with a large lump in my throat. My doctors started running the tests and that's when I got my diagnosis. They wanted to operate about a year after that, but my family wanted me to come back to Australia and have the operation here. We tried all different treatments and nothing was really going to rectify my thyroid condition. That combined with the fact that my goiter was just going to keep growing, we all thought it was safest to have a total thyroidectomy. So I had that done in 2018. Several months before going on to MasterChef. It was pretty scary. I'd never had major surgery before, but I was really lucky to have an amazing surgeon. And actually, in fact, the goiter turned out to be about 15 centimeters. So there was about 5 centimeters in my neck and 10 centimeters in my chest. It was a bit like an iceberg. But yeah, it was really large and they weren't really sure how I was breathing without a lot of difficulty. So yeah, better out than in, I always say. Where am I now? I am taking thyroxine every day and just trying to find that perfect balance, as anyone with a thyroid condition knows. What have I learnt about thyroid conditions? Well, I learnt that they exist. So I don't really think there's enough information out there or awareness, to be honest with you. And I notice it in so many different people now because I know the signs to look for. But I think the most important thing that I've learned is how much of your body is controlled by your thyroid. I think I spent a lot of time thinking that there were problems that were just part of who I was. And in actual fact, they came back to my thyroid. And as soon as I had that under control, I was able to live a lot healthier and happier. So, there needs to be more awareness about what your thyroid actually does for you.
I'm Loretta. I'm a mother of 3 adult children and work full-time as a business support manager. I was diagnosed with papillary carcinoma in January 2018. Approximately 5 years before I was diagnosed, I started feeling very tired and my body was aching all the time. I also felt nauseous, and that nauseous feeling I had pretty much on and off all my life. The symptoms of being tired and bones aching all the time was what made me go to the doctor for tests. I was also really exhausted. Even if I had 8 hours sleep during the day, around 3 I always needed a nap. And usually the nap lasted about 2 hours, just in time for me to, I'd wake up just in time for me to prepare dinner. I felt my bones were very achy and I felt really uncomfortable in my body. My GP arranged a few blood tests, and the only test that came back positive was anti-nuclear antibodies, which made them think I had lupus or rheumatoid arthritis. So they started doing some scans and everything came back clear. They never checked my neck or did full blood tests for thyroid conditions. It was suggested that the only reason for my symptoms was fibromyalgia. At this point, I had seen about 3 different specialists, and they told me there is no cure for fibromyalgia and to consider meditation for relaxation. Now, at that time, I was very busy. My children were younger, and therefore they put it down to stress and perimenopause. So I started meditation daily and continued my daily routine, still feeling unwell and constantly tired though. My weight fluctuated a lot as well. I just pushed myself and accepted my diagnosis. But then one morning, 2.5 years ago, I woke up feeling really well and said to myself out loud, today's a good day. And I stopped myself and thought, well, that's not good. Every day should be a good day, right? I intuitively knew something was seriously wrong. So I went to my doctor and told him that I had a cancer in my body and he needed to find it. I told him my symptoms had not changed from 5 years ago and I knew something was seriously wrong. We arranged blood tests, but this time thorough blood tests, my thyroid as well. One of my tests came back extremely high level. So my doctor had told me that I had Hashimoto's disease, which explained my body weight fluctuating, being so tired. But my weight fluctuating from one day to the next. I then had an ultrasound and biopsy, which came back suspicious of papillary carcinoma. My surgeon and endocrinologist confirmed that I would have had the nodule there for at least 5 years. It's now over 2 years since my diagnosis and I'm fully healed and have recovered really well. 3 months after surgery, I had radioactive iodine treatment. About 12 months after the treatment, I had a sore jaw and also salivary glands were swollen. And my endocrinologist explained it was a side effect of the treatment, but I was very lucky, it was just temporary. I have regular checkups and ultrasound as well. I like to get my blood tested regularly to make sure I'm on the correct dosage. There are different types of thyroid conditions, different types of thyroid cancers too. A big thing I learned was that most thyroid cancers are curable if caught early. Symptoms are different for everyone, but if you're a woman between the age of 35 and 50 and you're feeling tired all the time and your mood is all over the place, Don't think that maybe your symptoms are perimenopausal or menopause, because every time I went to see a doctor, that's what I was told. Or I was also told symptoms were due to stress, so it could be fibromyalgia. Since my surgery, I feel so much better and symptoms I had are gone. Your thyroid releases hormones that control your emotions, your mood, metabolism, even body temperature. If you don't feel well, then insist your doctor checks your neck. It's your body. You know if it's not balanced, and we are meant to feel really well.
My name's Vic, I'm 44 years old. I am married with a very active 2-year-old. I'm an electrician and I run my own business. My condition is thyroid cancer. I was diagnosed by chance. My doctors were trying to treat a different condition that I have, and in the process they suggested a hemithyroidectomy. When the biopsy came back, they found the cancer. I found out that most cases of thyroid cancer are very treatable and you can go on to live a long and healthy life. I was diagnosed 15 years ago, back in 2005, so I am in remission and living a healthy lifestyle.
Now that we've heard from patients talking about their thyroid disease, let's now hear from the ATF's Principal Medical Advisor, Professor Eastman, discussing tests and diagnosis of thyroid disease.
The Australian Thyroid Foundation, that supports people or Australian citizens with thyroid disorders and also educates the population, wants the Australian population to be more aware of the problems of thyroid diseases and the need for individuals who may have a thyroid problem to actually go and get tested. Now, it's a disorder that's often overlooked, not discussed very much, but it is one of the commonest disorders that we have in Australia. The two major causes are autoimmunity, where the cells in the body actually attack that individual, and these disorders can cause an underactive thyroid or an overactive thyroid. The other cause is iodine deficiency, that's dietary iodine deficiency, that can result in a swelling of the thyroid gland, and if it occurs during pregnancy, which it does, then it may result in the child being born with a lower IQ. Now we know that there are several million people suffering with thyroid diseases in Australia, and we also know that from our estimations that there are around 1 million people who have a thyroid disorder but have not yet been diagnosed. Now, if you don't think of it and if you don't get tested, then you won't get a diagnosis and you won't get treatment. So if you think that you may have a thyroid disease, then discuss it with your doctor, ask to be tested, ensure that the tests are appropriate, and ensure that the tests are normal to reassure you that you don't need treatment. Now, thyroid disorders can affect you at any stage of life. They're particularly relevant for children because it interferes with growth and development. Thyroid disease in pregnancy is particularly important. It must be tested for early during the pregnancy, in the first couple of months of pregnancy, to ensure that treatment is given to prevent the loss of the pregnancy, or if the pregnancy does proceed, to ensure that the child doesn't suffer some mental effect or intellectual disability. Now, all pregnant women should be tested very early in pregnancy. If there is a family history of thyroid disease, or you, the woman who wants to get pregnant, thinks she may have a thyroid disorder, then she should be tested before pregnancy, and she should ensure that the doctor also tests for thyroid autoantibodies, because the problem is most commonly due to an autoimmune disorder. The other important issue with pregnancy is ensuring that the woman gets enough iodine. If she doesn't get enough iodine in her diet, then that may cause problems for the brain development of the fetus. And the only way to ensure that you get enough iodine is to take an iodine supplement. So it is important that you discuss this with your doctor and you get tested very early during the pregnancy to ensure everything is okay. Thyroid disorders can affect you at any stage of life, and the other important time is for the older population, because a lot of the symptoms of thyroid disorders, particularly an underactive thyroid, are very vague. There may be effects on memory, there may be effects on your ability to think and do your normal work, tiredness, weight gain, skin changes. A lot of these are just put down to the fact of ageing, when what you are seeing is an underactive thyroid. So if you are concerned about changes in your body or symptoms where you're feeling different, then speak to your doctor and ask to have a thyroid test. That is terribly important, because oftentimes this is not picked up until the disease progresses quite severely, and it's very difficult then to reverse. So overall, to summarise, thyroid disorders in Australia are very common. There are over 1 million people, we estimate, have a thyroid problem that haven't been diagnosed, they haven't been tested, and they need to be. So during Thyroid Awareness Month, we need to bring that to everybody's attention, that if you think there is a problem, or in the case of pregnant women, you need to be tested. So talk to your doctor and get the appropriate tests.
Thank you for watching this episode of Recover Me discussing thyroid disorders. If you would like to learn more and kept up to date with thyroid information, please visit the Thyroid Foundation website, thyroidfoundation.org.au, and also Recover Me. Thank you.
This Recover Me episode on thyroid disorders has been produced with assistance from the Australian Thyroid Foundation. All medical information and interviews with patients and healthcare professionals in Recover Me have been organised by the Australian Thyroid Foundation. This information is for awareness only and should not be used for treatment. Please consult your medical professional if you have further questions and seek medical treatment. Recover Me captures patient stories, interviews with healthcare professionals, and presents information supplied by health charities for the purposes of promoting public health literacy in an engaging and accessible manner.